First, let's look at the top stories. CM flags off aggressive mass COVID-19 testing drive in Far West District. Four out of 29 curfew violators found to be positive for COVID-19. And Kanarjit Kangujam brought to Infal to face various charges of forgery, cheating. Hello and welcome viewers, you're watching the MAMITv English Primetime News. This is Blessing Yang Mai. Now let's have the news in details. With the aim of early detection and early treatment to flatten the COVID-19 curve, Chief Minister N. Biren Singh today flagged off aggressive mass COVID-19 testing drive in Infal West from the Health Directorate Lamphel. The mass testing drive is organized by the District Administration Infal West. Different teams consisting of medical staff have proceeded to different locations around Infal West District to conduct the mass testing drive. Addressing the gathering, the Chief Minister expressed that he felt proud of the spirit and courage shown by frontline workers including doctors, nurses and other paramedical staff while rendering their endless services to save the lives of people from the pandemic. He added that as the Indian Army sacrifices their lives in protecting the sovereignty of the motherland in many instances, health workers do take an important role in saving the people's lives in this crucial hour of the pandemic. Stating that the government had been putting in every possible effort to fight COVID-19, N. Biren maintained that mass testing and mass vaccination drive was taken up to prevent the state from moving towards any uncontrollable situations. Maintaining that saving precious lives of people as priority in this hour, he appealed to the public to cooperate with the mass testing drive so that early medication could follow. He stated that positive cases would rise for some days with the beginning of mass testing. However, it could come down gradually. He further informed that he had advised sitting MLAs of all 60 assembly constituencies to set up community isolation centers in their respective assembly constituencies for accommodating COVID-19 positive patients who are likely to increase with the mass testing drive. Deputy Commissioner Infal West T.H. Kiran Kumar stated that around 3,500 to 500 testing will be done every day for the next 15 days to identify positive cases and take necessary measures. He added that such step would help in bringing down the number of positive cases in the following days. He expressed his thankfulness to the State Health Department, Manipur University, Kanchipur, Heritage Convent, Uripok local clubs and others for their support and cooperation in such initiative. The flagging off ceremony was attended by Advisor to Chief Minister Health, Dr. Sapam Ranjan, Principal Secretary V. Bumlunmang, officials of District Administration, Infal West and Medical Directorate among others. In a startling incident, 4 out of 29 persons who were moving in Singzamai area in violation of the curfew were found to be positive for COVID-19 during an on-the-spot testing conducted on them as a punitive action. The team of Singzamai police station detained as many as 29 persons for violating the curfew and compelled them to undergo spot RAT testing for COVID-19 as a punitive action. 4 persons were tested positive, report said. A team of Manipur police has brought Kangujam Kanarjit, also known as Dr. K.K. Singh, to Infal by flight this afternoon. He was arrested on Monday in Delhi by a combined team of Delhi Police Special Cell and Manipur Police in a joint operation. Kangujam Kanarjit has been facing criminal cases in connection with forging of documents, signatures, and presenting a larger-than-life image of himself. He had collected funds and fees from national and international students in the name of International Youth Committees, IYC, organizing youth meets and other seminars, relief for earthquake victims, etc. He fled from Manipur in a few years back, and the Chief Judicial Magistrate of Imphal East had declared Kanazit as an absconder on April 25, 2016 on a criminal case number 37 of 2015, charged under different section of CRPC. MLA of Kundrapam Assembly Constituency T.H. Lokeshwar today handed over 7 rice cookers, 7 pressure cookers, 7 induction heaters, 7 heaters and ration to the management of COVID care center opened at the NV College to help those put up at the center. Medicines for the inmates and PPEs to be used by the volunteers were also handed over. In connection with the occasion, MLA Lokeshwar said the number of positive cases has drastically come down since the opening of COVID care center in the constituency. The number of positive cases used to be quite high when the home isolation system was in place. Mobile testing at the village has also helped reduce the number of positive cases, the MLA said. He further said that it is illogical that those whose Aadhaar cards had not been linked had been deprived of their due rice quota, which has made them suffer still more. MLA Lokeshwar appealed to the authority concerned to depute a nodal officer for its assembly constituency to solve the matter.
COVID positive masing henggal pase masing arang de handare Madam Indira Devi se yamna well kanoni yam phajal thabak togi har banda no haide kaino tana ba tau shadna tawbadagi usina jina leka da sala ga hujise har ba test tawbadagi mai palak de ngasima khoi mi chani ma thak tawi adu mi 13 13 hena yaude yar ba singsiu positive oida laira ba home isolation tawba family du da ngatani yar singje adu ga moi contact tawba mi sing dudi amata yaude kaino 300 test tawba kan da 300 adu ga ada leba kan task force senabadagi 300 thammadagi usina jana hujiti covid positive obi sang handar le.
To ease the mounting pressure on the healthcare system of the country, the Art of Living has started a nationwide 24/7 COVID care helpline. The main feature of the helpline is the doctor's on-call service. A press release issued by the State Media Coordinator, the Art of Living, Dr. K. Romeo Mitei, stated that under this service, the public can get basic and preliminary consultations and guidance from qualified allopathic, Ayurvedic and homeopathic doctors either by phone or WhatsApp. The service is accessible on 743-997-9984. Currently, consultation is available in English, Hindi and Bengali. Soon, other than Indian language will also be added, Dr. Romeo Mitei stated. He further informed that the Art of Living has also started an anxiety helpline in Maitilon to help the people of Manipur in coping with anxiety and stress arising out of the current humanitarian crisis. Anyone who is experiencing anxiety can call on 700-565-8504 to get advice and guidance on mental well-being from the Art of Living counselors in Maitilon, Dr. Romeo added. Under the initiative of MLA of Wangjing Tenta, Paunam Brojen, along with the COVID Care Committee of Wangjing Tenta, Tenta Gram Panchayat, COVID Task Force, and Head Distribute Welfare Officer of Taubal jointly held COVID vaccination program at Tenta Multiplex. About 200 people of Tenta Gram Panchayat were vaccinated. Later, the MLA organized another vaccination program at the Sapam Community Hall in association with Sapam Gram COVID Task Force Committee and District Welfare Officer of Taubal. MLA Paunam Brojen thanked the COVID Task Force personnel, doctors, nurses, and health workers who tirelessly helped in vaccinating program. Amid the surge of COVID-19 second wave, the team Katrigao 360 distributed food items to 200 poor families of Katri Awang Laikai, Katri Bangun, Awang Laikai, Herakul, Sabalaikai, Pangong, Katri Chandam, Porampat, and Yangbi. Jila Parishad member of Khetri Part 1, MD Narjul Islam, Goro Pharmacy and Ithem Pharmacy had also contributed items to them to Team Khetrigao 360. They said they will continue such work to help the people. Social worker Larembam Sanjoy today announced that he will help the patients who were at the COVID care center of Ngarian Hill, Andhra, Kendra by providing meal for 10 days. He also said that he will continue to help the people of Andhra who are in containment zones in every possible manner he could. Later, he also distributed face masks and hand sanitizers to the police stations of Andhra and Yaripok. Following the exclusive report aired on the MAMITv about a 5-year-old kidney dialysis patient, Nauroibam Ulen Ngamba of Kurai Lamlong, several individuals and organizations have come forward to extend financial help for this treatment. Koirom Elizabeth of Moirang Market, who is employed at the Bishnupur District Hospital, has also donated a sum of rupees 5,000 to Ulen Ngamba's mother. People of Kakching Assembly Constituency, Ward Number 2, stopped collecting the PMZKAY allotted rice due to distribution in insufficient quantity. AVO Club, Kakching organized a public meeting in order to discuss the matter. Condemning the distribution of 3 kg of rice rather than government imposed 5 kg, the club appealed to the authority to look into the matter. The club asserted that they had informed the Kakching DC about the issue before. NR Media has handed over vapor machine, face shields, face masks and hand sanitizers to Celine Digital. Managing Director of NR Group of Company, N. Norend, and proprietor of NR Media, NR Rajesh, handed the items to producer of Celine Digital, Panjabam Lanajit Singh. Speaking on the occasion, PH Lanajit said that he appreciates NR Media for recognizing the efforts of Celine Digital during the ongoing COVID pandemic. He said, "We should all take the COVID vaccine and follow the SOPs in order to eradicate COVID." Even as the second wave of COVID-19 pandemic has spread far and wide, eminent singer of Amik Poire Tokchom, music director, appeals to the people through MAMITv to take utmost care to protect themselves from COVID-19.
Ahanamuktada mayambu ikungno koramjari tawgedang namba miyebe ko dengan city coronavirus na landargle hariba virus asibu male masidi maru phangna muthanaba amata ngairo pambaidi aikoi masel amaga gi marakta wakhal taminaba asini sarkarna pibiriba guidelines in mayamnu sena khangbire nongmada sangba yadrba essential commodities chana thaknaba amasung medical ga bari lenaba natana yumdagi mapan chungtok mak thopirudabani karigumba tangai mok fadana thopiba tarbasu mask sususunu upiyo amasung social distancing maintain tobi khutcha toina hamdokpa sanitizer sinaba mayamna sungsoi soidana kawbirodabani aikoina COVID-19 virus asibu maithiba piki haibagi khudam changdam male masida thaminarsi mayamu kuramjari.
After the break, stay tuned.
MAMITv na miyam gidamak laibak pokpan numit ki numidang wairam pung 8 taba matamda sandok sargani online doctor consultation program sandok sagadori ba thoram asida COVID-19 na maram oiduna home isolation tawriba miyoi singa thengnariba pungning wakalgi awaba kaya ko anbang ngamnanaba pandamda MAMITv na puthokpa online doctor consultation program ni miyam da sandok sagadoribasi maram aduna online kuthangda home isolation tawriba miyoi singna mobile number 8413975 da call tawbiraktuna doctor amadi expert singa hakthengna wari sanabagi khudong chaba lobiyu.
Welcome back after the break. Now in the national news, India has recorded less than 3,000 new deaths in the last 24 hours, the lowest single day rise in 34 days. Daily case count also continued the downward trend to 1.27 lakh new cases in a day, with 2,795 COVID-19 deaths in the last 24 hours. India's death toll now stands at 3,31,895 as per Union Health Ministry data. India's COVID cases in May was the worst witnessed in any country for any month since the beginning of the pandemic, both in terms of the absolute number of cases and fatalities. India officially recorded nearly 1.2 lakh fatalities during the month, which was 2.5 times the total reported in the country in April, 48,768. Meanwhile, India recorded 1,27,510 new COVID-19 cases today, taking the national cash load to 2,81,75,044 as per Health Ministry data. With 18,95,520 active cases, India's active case load is now below 20 lakhs after 43 days. In a bid to further push the COVID-19 vaccination drive in the country, the union's government is planning to inoculate around 1 crore people daily beginning mid-July or August. Sources were reported as saying in a report that discussions were underway in the government on how to ramp up daily inoculations. Chairperson of the National Task Force on COVID-19 vaccination has said that by August, they will have 20 to 25 crore vaccines doses per month and aims to vaccinate 1 crore people every day. The government is targeting 1 crore daily jabs from mid-July as it is hopeful of receiving improved supply of vaccines from Serum Institute of India, which manufactures Covishield and Bharat Biotech, which has developed Covaxin. Further, the government is expecting Russia's Sputnik V to be available in good numbers, as local production of the vaccine is also expected to start soon. The vaccine availability may improve further if jabs developed by Pfizer and Moderna also make their way into the Indian market by then. According to the government, it has so far supplied over 23 crore COVID-19 vaccine doses to states and union territories so far. The Delhi government had permitted home delivery of liquor amid COVID-19-induced lockdown across the national capital. The government has apparently taken the decision to reduce the overcrowding at liquor stores. The Delhi Excise Amendment Rules 2021, notified on Monday, allow license holders to deliver liquor booked through an app or a website at the doorstep of the buyers. The rules also permits the holders of the necessary license to serve liquor in open spaces such as terraces, the courtyards of clubs, bars and restaurants. Delhi is currently under lockdown since April 19. Meanwhile, the daily positive rate of COVID-19 in Delhi has dipped below 1% for the first time since March 19, as the national capital reported 648 new COVID-19 cases in the last 24 hours. The daily positivity rate is at 0.99%. The cumulative count of the coronavirus cases in the city went up to 14,26,240. With 86 deaths in the last 24 hours, Delhi registered less than 100 COVID-related deaths for the second day in a row. Jharkhand Chief Minister Hemant Soren has written to Prime Minister Narendra Modi seeking free COVID-19 vaccination for people between the age group of 18 to 44, saying that the state has been unable to bear the burden of rupees 1,100 crore. Soren said that the state is stressed under the second wave of the deadly pandemic. With the vaccine being available for the age group 12 to 18 years and below, the financial burden will further increase by around rupees 100 crore. It will be extremely difficult to spare as many resources from the resource pool of the state, which is already stressed during COVID times, Soren said in the letter. He also criticized the government for its decision to ask the states to produce vaccines and said that the move was against cooperative federalism. This is probably for the first time instance in the history of independent India that the states have been mandated to procure vaccines on their own, he wrote. Now, before we end, let's look at the headlines once again. Chief Minister flags off aggressive mass COVID-19 testing drive in Imphal West District. Four out of 29 curfew violators found to be positive for COVID-19. And Kanarjit Kangujam brought to Imphal to face various charges of forgery and cheating. Well, that's all we have in this news hour for now. From the entire team of MAMITv, thank you so much for being with us. Till then, stay safe.